The Court of Appeal has lifted orders suspending the implementation of the Social Health Insurance Fund, which replaces the NHIF Act. This means you will now start contributing 2.75% of your gross salary each month. In the verdict that was delivered by Justices Patrick Kiage, Pauline Nyamoya, and Grace Ngenye on Friday, January 19th, the judges said, and I quote, "There is a real and present danger to the health rights of countless citizens who are not parties to the litigation pending before our courts." Now, which orders were specifically lifted? This is the suspension of the High Court orders restraining the implementation of the Social Health Insurance Act 2023, the Primary Health Care Act 2023, and the Digital Health Act 2023. But some sections of these acts remain suspended. These include, number one, Section 26(5), which requires registration and contribution as a precondition for accessing public services. So that still is suspended. Number two is Section 27(4), which required access to health services will be based on up-to-date contributions. So that is suspended. And number three, Section 47(3), which is an obligation for unique identification for health service provision. So those three sections are suspended. So you will not be required to have up-to-date contribution to get health services, and contribution to SHIF is not yet a precondition to access government services. What are the next steps? Now, the parties have been given 7 days to file written submissions on the suspended sections, and the registrar of the appellate court is going to allocate a hearing before 31st March 2024, which means it is possible that your January and even February salaries are going to get the 2.75% deductions. Now, one of the petitioners was the Kenyan Medical Practitioners and Dentists Union, which is KMPDU, who argued that the government implemented the acts without engaging stakeholders to resolve the contentious issues. Click on the link provided for a detailed article on this by money254.co.ke.